ran a trial, a small trial, but it was 30 patients each of patients who were going for allogeneic transplantation for patients with high-risk acute myeloid leukemia that has a very specific mutation, which is a mutation of the FLT3-ITD gene. Those patients typically and have historically had a poor risk of long-term survival, and it's considered a standard of care by itself to take those patients to transplant. With the new data emerging that midostaurin could actually improve the survival of a patient with acute leukemia during induction therapy, we actually set up to look at could we enhance the outcome of a patient undergoing transplantation in that same setting with the drug midostaurin. And so this was a study. It was looking for a signal of taking basically 30 patients per arm, 30 receiving on a standard of care approach without an additional adjuvant tyrosine kinase inhibitor, and 30 patients with the adjuvant midostaurin as a specific tyrosine kinase inhibitor that would target that FLT3-ITD. Of course, that drug has other activities that could potentially either negatively or positively impact the outcome of transplant. Patients went through transplant when they successfully recovered for their blood counts after transplant, then they were eligible for entry. Patients would go on and be between 1 and 2 months after transplant. They would be entered in the study, and then they were either followed for 12 months, as we would follow any donor transplant patient, or followed for 12 months receiving a dose of midostaurin. The results showed that there were some toxicities that were seen in the recipients of midostaurin, and that was typically a little mild GI toxicities, and they were easily controlled. I think the exciting data that came out was the fact that the patients in a disease that we typically would have expected early relapse and high relapse risk with a poor overall survival, that 85% of patients are remaining free of disease and alive 2 years out from treatment. The primary endpoint was 18-month relapse-free survival. It met the primary endpoint. It met the secondary endpoint of a 24-month relapse-free survival as well as overall survival. I think what's very interesting about the study, this was open label, so patients knew that they weren't getting midostaurin. We did have a dropout of a number of patients on the standard of care arm. Anecdotally, we've heard that some of them went on to look for other sources of medicines that could have a similar suppression of a tyrosine kinase. Either way, the standard of care arm also performed superior to what we would have expected, with a 70% 2-year overall survival. Either way, both arms in this modern world of maybe better supportive care, and also this world of using tyrosine kinase inhibitors as a adjuvant therapy, we've seen better than what we would have seen historically. We do acknowledge there's a randomized trial going on nationally that's placebo-based. We'll look for those results to emerge. Interestingly, earlier in the session, there was a randomized trial that was blinded from using another drug called sorafenib that had actually similar survival benefits and relapse-free benefits for patients with this high-risk leukemia.